Hi everyone, welcome to part 5 of this series on gluteal injuries, and in this part, as you could probably guess from this picture, we are discussing the gluteus maximus and also associated trigger points. So the gluteus maximus, as you can see, is the most superficial and the largest of the gluteal muscles, forming the sort of rounded shape of our bum cheeks. So the gluteus maximus helps to control lower body movement by maintaining the balance between the hip joint and the thigh. So it helps us when we're walking, running, climbing stairs, squatting, and it basically contracts to assist us with forward movement of the body. So in terms of identifying causes of injury to the gluteus maximus, it's actually often difficult to identify a cause because the weakness and pain may be present in other areas of the body, such as the back, the hip, or even the knee. And certainly runners, will, if they don't engage their glutes, quite often they'll notice that they're sort of feeling sore in other areas, such as the calf, for example. But certainly suggested causes for gluteus maximus injury include obviously overuse of the muscle, poor posture, trauma, whether that's a fall or a direct blow, strenuous exercise where maybe the hamstring hasn't been stretched first. Hamstrings are connected to the glutes, so they may also be painful with gluteus maximus injury. And again, in the case of a runner, weak hamstrings can cause overstretching and pain of the gluteus maximus, which may then cause the legs to give out. So that's just something to be aware of. There is certainly an increased risk of gluteus maximus injury in activities such as running, a lot of walking uphill, so people who are sort of going out for long hikes, repetitive kicking such as in martial arts or maybe some forms of dancing, and also with weightlifting, particularly if you're doing a lot of things like squats and deadlifts. And of course, if you've had a fall, there's always the potential as well for a gluteus maximus injury. Now, pain can result from sciatica. I have done a video on this, so do check that out if it's relevant to you. Pain can result from sciatica originating in the lower back and potentially travelling down the legs via the buttocks, following the route of that sciatic nerve. As with many gluteal injuries, sitting for prolonged periods, so if you're maybe a taxi driver or someone who works at a computer all day, certain chairs may not support the gluteus maximus and surrounding muscles, and so they can encourage poor posture. And potentially again, if you've already got weak hamstrings, that protective mechanism on the lower back that helps you with your sitting posture is not going to be there, so you're going to be more prone to injury because there's going to be sort of more stress on the gluteus maximus while trying to support the body in a sitting posture. So types of gluteus maximus injury and their symptoms. So the first one we're going to talk about is gluteus maximus syndrome. Now, this is where you get spasm or tightness of the muscle, which then pulls the coccyx, which is that sort of tailbone, and this can cause pain when moving into or from a sitting position. Tenderness or stabbing on one side of the buttocks may be present, The pain may stop once you're sitting, but can be reproduced by pressing on the point where the gluteus maximus meets the coccyx. Also, hip movement may be restricted. So let's take a look at the trigger points that are associated with gluteal muscles, because another type of injury that we're going to talk about is gluteus maximus trigger point. Now, obviously, trigger points can happen pretty much anywhere, but these are sort of common trigger point sites related to each muscle. So just on that lower back there, you can see 4 green dots, which correspond to trigger points in the quadratus lumborum muscles. Then working down onto the buttocks themselves, you've got 2 yellow dots there, which correspond to trigger points in the piriformis, which of course, if you've watched my other videos, you'll know that if the piriformis is tight, that can compress the sciatic nerve. You've then got these 6 blue dots around the side of the buttocks, which corresponds to trigger points in the gluteus medius. And then you've got the 3 purple ones running diagonally across the bum cheek, which correspond to the gluteus minimus. With regards to the gluteus maximus, you've got these 3 sort of pink spots. So one quite sort of high up there, right near that coccyx area, and then 2 lower down. So, talking about those trigger points of the gluteus maximus, those last 3 pink ones that we saw, gluteus maximus trigger point pain will occur, in basically when you've got pain in any of one of those 3 areas. So trigger points, and again, I've done a video on trigger points, so do take a look at that. Trigger points are small, tight muscle bands that are found in the muscle and that are really very sore when pressed. They can cause referred pain in the back of the hip and the thigh, sort of up the top of the thigh near the hip joint. They can refer pain to the base of the spine and the upper buttock alongside and into the gluteal fold. Pain in the medial trigger will cause tenderness at the edge of the sacrum to the gluteal folds, or potentially down the back of the thigh. Pain in the lower trigger point can cause deep tenderness across the entire buttock region, causing stabbing pain while sitting. Pain in the tailbone trigger will result in pain in the coccyx, and that's going to appear while you're sitting. Now, there may be aching or pain and stiffness in the outer hip and lower back. There may be a sharp pain when you get up to stand after sitting. It can result in burning pain in the buttocks, an uncomfortable or painful sitting. You may find that the pain increases when you're walking uphill or climbing stairs, and there may be either increased pain, or you may just feel unable to bend over and touch your toes when you have this trigger point pain. Now, other muscles such as the gluteus medius, gluteus minimus, piriformis, quadratus lumborum, also the iliocostalis will exhibit similar symptoms as well. Trigger points in the gluteus maximus may result in other trigger points developing in other muscles, such as the gluteus medius and minimus, possibly the TFL, the hamstrings, iliopsoas, which one of your hip flexors, or the pectineus, which is your adductor muscle that sits right into the groin, and also the rectus femoris quad muscle at the front of the thigh. These trigger points can be caused by a lot of sort of sport that involves a lot of jumping, so long jumps, high jumps, maybe even hurdles, or if you are falling and landing on your bum, even with swimming, which we always think of swimming as the best exercise, but even with swimming, if you're using a flutter kick, that can that can bring about trigger points. As we've sort of mentioned, weightlifting, or sort of if you're someone who goes out on long sort of uphill hikes and you're doing a lot of climbing, potentially I guess even sort of like rock, even like on the indoor rock climbing walls. If you're doing a lot of deep knee bends, so maybe if you're doing a lot of squatting, repetitive lifting of heavy objects, even if you are doing the right thing and you're bending your knees, this may protect your back, but actually it does put a huge amount of strain on the gluteus maximus. Prolonged sitting on hard surfaces, sitting for long periods, or sitting, if you have a wallet in your back pocket, all of these can promote gluteal trigger points. So how can we best treat these trigger points? Physiotherapy. You can use a heat gel, which will relax the muscles and relieve the pain. There's I think it's one called Sombra warming gel. This can be quite effective because it will relax the muscles and relieve pain, but it doesn't have that burning kind of heat that some of the other heat gels can have. Obviously massage, if you see someone who sort of deals with trigger points, so you're going to want like a sports therapist. They can work directly on those trigger points. Obviously we talked about heat gel there. Also, as always, hot and cold packs. There is one called Core Pack, Soft Comfort. You can get a large hot and cold pack wrap, and this is ideal for gluteal muscles. It can be used cold to reduce swelling, or warm for sort of older injuries, chronic pain, to relax the muscles and increase circulation. And of course, if you are getting pain around that coccyx area and it's hurting to sit down, you can get a coccyx cushion, or to help relieve pressure and pain in the lower back, hips and thighs when sitting. But it would be good if we could avoid these trigger points from developing in the first place. So how do we prevent them from forming? So don't sit for hours at a time, because it will shorten and tighten those gluteal muscles. So if you work in an office, possibly having a standing desk may be beneficial, and certainly I think a lot more offices are becoming aware of the need for these. But you know, if you don't have one, just sort of try every hour or two just to get up and have a, I don't know, even if it's just to, you know, wander off to the loo or to go and get a coffee or whatever. Just something to sort of change your position. Take your wallet or phone or whatever it is out of your back pocket before sitting down. If you're doing exercises, warm up before, you know, and just sort of do some stretching before exercise. And don't push the muscle. You know, so many people just really push and push, you know, in the gym. Don't push the, you know, past that point of muscle fatigue. You know, particularly if you're like running, or maybe you're sort of doing work on a stepper, for example. If you are climbing or, you know, doing long hikes, you know, take breaks, you know, just to kind of sort of break up those repetitive movements. And of course, you know, if you are in the gym and you are lifting weights, you know, make sure that you are using correct technique. You know, maybe just have one session with a personal trainer just to ensure that you're doing it, you know, right, and you're not going to be putting extra stress on, you know, on other areas. So that is pretty much it. You can of course also, I guess, use a foam roller. It can be effective on tight glutes. Potentially it could help with trigger points. But of course, you know, if you see a sports therapist who sort of knows their trigger points, then they can, you know, sort of directly treat that point. So that that brings us to the end of this series on gluteal injuries. If you've not seen the other 4 videos, do take a look or subscribe to my channel. And feel free to comment down below. You can message me through my Facebook or Instagram. I'm on there as the Medical Massage Lady. Any questions, I will answer you. But yeah, that's really it from me on gluteal injuries. So take care, and I will see you with the next video.